This patient education video talks about the HBA1C test. In this video, you will understand what HBA1C is. How does the test work? Why is it done? What do the results mean? How often do you need to get it done? The Hemoglobin A1C or HBA1C test tells you your average level of blood sugar over the past 2 to 3 months. You may need the HBA1C test to evaluate your risk for developing diabetes, to diagnose diabetes, monitor long-term control of blood sugar in people who have diabetes, and help make treatment decisions. How does the test work? Hemoglobin is a protein found in red blood cells. It gives blood its red color, and its job is to carry oxygen throughout the body. The sugar in your blood is called glucose. When glucose builds up in your blood, it binds to the hemoglobin in your red blood cells. The A1C test measures how much glucose is bound. Red blood cells live for about 3 months, so the test shows the average level of glucose in your blood for the past 3 months. If your glucose levels have been high over recent weeks, your hemoglobin A1C test will be higher. What does the HbA1c test indicate? For people without diabetes, the normal range for the hemoglobin A1C level is between 4% and 5.6%. Hemoglobin A1C levels between 5.7% and 6.4% mean you have pre-diabetes and a higher chance of getting diabetes. Levels of 6.5% or higher mean you have diabetes. Does the high value of HbA1c always mean are you diabetic? If you get a high HbA1c level, it does not necessarily mean that you are suffering from diabetes. People with diseases affecting hemoglobin, such as anemia, may get misleading results with this test. Also, there are some medications which can alter your results of glycosylated hemoglobin test levels. These include supplements like vitamin C or E, iron, vitamin B12 and folate. If you're going for a glycosylated hemoglobin test, your doctor will make sure of the factors that can affect your test results. Quantity and quality of food can have a great impact on your hemoglobin levels, which can get you incorrect values. Gestation, recipients of donated blood, long-term kidney failure can reflect abnormally low HbA1c values. You'll probably get tested once a year if you have pre-diabetes, which means you have a strong chance of developing diabetes. You may get tested twice each year if you have type 2 diabetes, you don't use insulin, and your blood sugar level is usually in your target range. You could get it 3 or 4 times each year if you have type 1 diabetes. You may also need the test more often if your diabetes plan changes or if you start a new medicine. Those who have higher levels of HbA1c can bring down the level of HbA1c to the normal range through medications. Apart from this, there are some natural ways as well which can bring your HbA1c normal. Quit smoking to get hemoglobin A1c levels down. Eat a balanced and healthy diet. Exercising is another natural way to control your increased levels of glycosylated hemoglobin. It helps in losing weight and lowering blood sugar, which ultimately results in enhancing insulin sensitivity. Adopt a healthy lifestyle to keep your blood sugar levels in control. The Hemoglobin A1C test may be done to evaluate your risk for developing diabetes, to diagnose diabetes, and to monitor long-term control of blood sugar in people who have diabetes and help make treatment decisions.